As the coronavirus tightens its grip on Indiana and the country, end-of-year holidays are causing concern. The exponential rise in cases will continue. With vaccine availability for the general public likely still months away, more lives will be lost. But is a full shutdown the answer? Brock Turner has more on the toughest choices facing policymakers.
Like many Hoosiers, Tanya Mintgen is ready to put 2020 behind her. She owns 3 Fat Labs, an event venue and bed and breakfast in Putnam County. 2020 has challenged her business in every way.
I ended up canceling March, April, May, and most of June. I got my last June wedding off here. So, that's pretty much 4 months of revenue. It's the staff didn't make any money, so, they were all hoping on unemployment, which if they worked for me full-time during peak season, they didn't get unemployment because they were a subcontractor.
Appearing in the Netflix series Say I Do led to a significant increase in bookings for 2021. But Mintgen worries if virus cases are still high next year, people will continue to cancel plans, weddings, and events.
With the ones that were postponed and moved, and the few that decided to cancel, I probably took a $175,000 hit.
The governor's latest order restricts crowd sizes to 25 in the highest risk counties, which is nearly half the state. Larger events can still receive special permits from local health departments, but that process can be time intensive. Experts say a robust contact tracing program would allow for the greatest economic freedom while limiting the virus's spread. And even if some businesses are closed, targeted aid could assist them.
Let's find a way to keep them economically viable and afloat until we have a vaccine. But we kind of have our hands tied because we don't really know what that is.
That aid hasn't come from the federal government yet. Congress is still debating a second economic stimulus, which has handcuffed local and state officials. Many experts agree the lack of federal support, paired with poor contact tracing, has led to the difficult choice Holcomb and local officials face.
I think one of our biggest concerns was that we didn't have a public health push in the governor's ear that was as impactful as the business community. And so it became a choice that doesn't really exist, because you can't really have a strong economy during a pandemic if people don't trust. People won't go spend money. So, we've all gotten into this battle about whether the economy should open or we should take care of the virus. But it's really, it all has to work together.
Eileen White experienced this firsthand. She's worked as an epidemiologist in several states and was eager to help her local health department in Fishers, but resigned after just a few weeks on the job, alleging political bias impacted science and data.
There's always some political component to any governmental job. I mean, we can't deny that lives in everything. But what I had never experienced before, which is new for most people in public health, is this twisting of data to fit a narrative that the data does not support.
That's something Fishers Mayor Scott Fadness denied, but he does agree that local governments can be put in a precarious spot.
They're granted the authority to take away people's abilities to do things and to restrict them in terms of commerce. But as a government, we are not provided the resources to alleviate some of those restrictions. So in a perfect world, you would have both capabilities so that you could architect a solution that says, hey, we have to change these behaviors for a period of time, and we know that has an economic consequence, and we can tailor a solution in our local economy to try to ease the burden on those most impacted.
I see that this is a struggle, right? Nobody in public health is saying that the economy isn't important. But what we're saying is that lots and lots of people getting sick will impact the economy. And hospitals are at capacity now. So we are not in a better place. And I think we've seen that the choices that were made did not work.
And when you talk about like the stay-at-home order or shutting down the economy, that's an extreme, right? We're going to shut everything down. Or even just opening everything up is another extreme. Kind of the optimal should be something where we identify the things that are spreading the virus the most and are also the easiest for us to reduce.
It's too late for many businesses. It's been nearly 10 months since the pandemic started, and many haven't been able to hang on. Mintgen, though, considers herself lucky. A federal Paycheck Protection Program loan helped pay the venue's mortgage while it was closed. Others, though, weren't as fortunate. She's seen many businesses she used to work with close.
I normally bring in about $70,000 a year on lodging. I brought in 26,000 this year. That was, yeah. So I mean, it's been felt by me. It's been felt by all the mom and pops in town. It's the mom and pop type businesses that are really feeling the effect of it.
All Minkin can hope for is this virus and the restrictions it's been married to in 2020 will be mitigated when weddings begin this spring. For Indiana Newsdesk, I'm Brock Turner.